Good day, I am Aldrin Havaliano and this is CHN Skill bag technique. Bag technique is a tool by which the nurse during her visit will enable her to perform a nursing procedure with easy and deftness to save time and effort with the end view of rendering effective nursing care to the clients. A public health bag is being used in this procedure. So, a public health bag is an essential and indispensable equipment of a public health nurse which she or he has to carry along during her home visit. So, this is to render effective nursing care to the clients and or the members of the family during a home visit. So for the principles, the following principles are essential when performing the bag technique to achieve the best results or the desired outcomes. So number one, performing the bag technique will minimize. So principles. The following principles are essential when performing the bag technique to achieve the best results or the desired outcomes. So number one, performing the bag technique will minimize, if not prevent the spread of infection. Number two, it saves time and effort in the performance of nursing procedures. Number three, the bag technique can be performed in a variety of ways depending on the agency's policies, um, the home situation, or as long as the principle of avoiding the transfer of infection is observed. And fourth, the bag technique should not overshadow the concern for the patient, but rather should show the effectiveness of total care given to an individual or the family. So, guidelines are special considerations. So, number one, the bag should contain all the necessary articles, supplies, and equipment that will be used to answer the emergency needs. Number two, the bag and its contents should be cleaned very often, the supplies replaced, and ready to use anytime. Number three, the bag and its content should be well protected from contact with any article in the patient's home. Number four, consider the bag and its contents clean and sterile, while the articles that belong to the patient as dirty and contaminated. And number five, the arrangement of the contents of the bag should be the one most um, convenient to the user to facilitate efficiency and avoid confusion. So for this procedure, the nurse needs a public health bag which contains basic medications and articles necessary for giving care. So the bag um, should include the following. So paper lining, an extra paper for making a bag for waste materials or a paper bag, a plastic or linen lining, an apron, a hand towel in plastic bag, a soap in a soap dish, two pairs rather, of forceps, syringes, a hypodermic needle or hypodermic needles rather, sterile dressings, sterile cord tie, adhesive plaster, an alcohol lamp, tape measure, a baby scale, a pair of rubber gloves, two test tubes, a test tube holder, a thermometer, two pairs of scissors, dressings, and medicines such as betadine, 70% alcohol, acetic acid, and hydrogen peroxide. Upon arriving at the client's home, place the bag on a table or any flat surface lined with a paper lining with the clean side out, which means the folded part should be the one touching the table. Then put the bag's handles or the straps underneath the bag. So this is to protect the bag from getting contaminated. So then we place the bag and the handles. And then next, ask for a basin of water and a glass of water if a faucet is not available. Then place a base outside of the work area to be used for the hand washing. Then open the bag and take the linen or a plastic lining and spread over the work field or area. So the paper lining should also be placed with a clean side out. So this is to prepare for hand washing. So next, take out the hand towel, the soap dish and apron and place them at one corner of the work area. So this is to prepare for the hand washing. So, assuming that I'm already done doing the hand washing, the next is to wipe dry with a towel. So, you have to leave the towel, the wrapper of the towel and also the soap dish in the bag. So this is to prevent the infection or to prevent infection from the care provider to the client. And then once you're done with the hand washing, put on your apron with the right side out and the wrong side with a crease touching the body. Okay. And then slide the head into the neck strap and then neatly tie the straps at the back. So this is to prevent soiling your nurse's or the nurse uniform. The next, put out the things most needed for the specific case. For example, again, vital signs. So we take this out. We take the thermometer out. And also, take out your extra paper or the what do you call this, waste paper bag and place it at one corner of the work area. So this is to have them readily accessible and for an easy performance of the procedure. So next, take the paper waste or rather the waste paper bag and place it outside of the work area to prevent the contamination of the clean area. So then after taking out all of the needed articles, you need to close the bag to give comfort and security and also maintain personal hygiene and to prevent the transfer of microorganisms. Then proceed to the specific nursing care or treatment. Okay, and then after completing the nursing care or treatment, clean and alcoholize the things used. So you get a clean cotton and your 70% alcohol. And then clean your thermometer. After cleaning the used articles, you put your soiled cotton ball or cotton in your waste bag. Okay, so this is to protect the caregiver and also to prevent the spread of infection to the others. So after doing this, perform the hand washing again for infection control. So assuming I'm already done washing my hands, then open the bag again and put back all of the articles in their proper places. So this is for organization and in preparation for the next use. So when removing the apron, fold away from the body. And the soiled part or the soiled side should be folded inwards and the clean side out. And then place it in the bag to avoid contamination from the soiled part. And then get your bag and fold the linen or plastic lining and place it in the bag and close the bag to avoid contamination. So, before you leave the house, make sure to take the trash bag or the waste bag with you, or you can ask a member of the family to dispose it on the proper receptacles. So before you leave the home just yet, make a post-visit conference on matters relevant to healthcare, taking also anecdotal notes preparatory to the final reporting. This is to be used as a reference for future visits. And then make an appointment for the next visit, either at home or a clinic visit, taking note of the time, the date, and the purpose. So this is for the continuity of care.